Hi guys, welcome to another very exciting tutorial. My name is Erens and I'm one of the doctors here. So today I'm going to share with you about the AMC Clinical Examination Online version. Okay, I'm going to tell you everything you need to know in detail about the AMC Online Examination. Okay, if you are doing the AMC Online Clinical Examination, you need to watch this video. All right, I am going to show you super detail what happens on the day of your exam. What I mean is from before going into the online environment, and when you are in the online environment, you begin with the common lobby. From the common lobby, you go into your breakout station. From your breakout station, you go into your exam station. And then you go back into your breakout station, and that cycle goes on for 20 times. Then when the end of the exam, you come back into your common lobby, and from there, the exam concludes. I am going to share with you every single step in super detail so that you can see that for yourself, what exactly happened. You don't have to imagine it. You can actually see it on the screen. And this will give you so much of advantage. You will know where you are in the online environment. Imagine having such a powerful advantage. So this will definitely help you if you are doing the AMC Online Clinical Examination. This video is also great for somebody who's considering whether they want to do the online exam or the face-to-face exam. If you are still deciding, then maybe have a look at this video, have a look at the steps, see what's going on, see whether, you want to prepare for the online exam or not. And if you think like, hey, the preparation is, this is something that I can manage, this is something that I would like to do, then consider doing the online exam, okay? But the most important thing is you got to understand what the online clinical exam is all about, all right? So, are you ready? If you are, I am ready. And then let's jump onto the screen and we will begin. Okay, let me just bring my laser pointer up. Okay, so let's begin. So I'm going to start with the learning objective. So what we are going to do today is I'm going to tell you regarding the online clinical exam. We're going to start with how your preparations are going to be on that day. That means on the exam day, what must you have on your table? Okay, I'm going to show you all of those things. I'm going to also tell you what are the essential materials, your pen, your paper, how you're going to set up your computer, what you need to have on, all right? So I'm going to talk about that. And then we're going to move on to the next step, which is to get an idea. I'm going to give you the idea on how the AMC clinical examination is conducted. All right, that is going to be a detailed video, and we're going to talk about what happens after you join the exam link. All right, you will have an exam link. AMC will set that up for you. That will be present in your candidate portal. Okay, your AMC clinical candidate portal. You click on that link, you go into the online environment. I'm going to show you how that looks like. You can see it for yourself. All right. The next step we're going to talk about is what should a candidate do in terms of the technical aspect of the exam. All right, this is an online exam. It's a lot of audio, video stuff, but let me assure you, you got to do nothing, mostly nothing. All you got to do is make sure your video and your audio is functioning well. I'll give you some tips. I need to tell you what tips you need to do to make sure that you reduce your technical error on your side. Okay, we will talk about that. The next thing I'm going to move on is on the essential tips. So I'm going to tell you the tips every step of the way, what tips you need to know during the online clinical examination. So you are going to be well informed, you're going to be prepared, you're going to be ready each time of the way, and you're going to know what's coming up next. All right, I'll also give you a little bit of difference with the face-to-face exam. So when you know the difference, the good thing is that if you're still deciding about whether it's the online or the face-to-face exam, this difference will will tell you or will help you to decide, to make that decision. All right. So let's move on. Here are some disclaimers. Okay. I need to tell you this at the beginning. So the beginning here is that the slides and the talk represents my own experience. I sat for the AMC Clinical Online exam on the May of 2021. So I'm going to share my own experience. My talk here does not in any way reflect the Australian Medical Council. Okay, I'm not giving this talk on behalf of the AMC. If you want more about the AMC Online Clinical Examination, you can do a few things. The first thing you can go into this link, amc.org/assessment. And under that, you go into the clinical examination. And you can also watch a candidate briefing video whereby they give you a short video on how the online exam is conducted. All right. The other disclaimer is all the images of people, right? All the people that I'm using here are all obtained from the general internet. They are not from the AMC or any copyright source as far as I'm concerned. All right. Okay, let's move on. So here I'm just showing you the AMC website. Under the assessment, and then / the clinical examination, you can see this part. Don't worry, don't stress yourself out. I'm going to put the link at the bottom of this video. You can have a look at that. Just click on it. You'll come here. And then what I'm going to tell you is, what I was talking about, the candidate briefing video is under here. When you click on this, you can watch a video and that will explain a little bit more about the AMC clinical examination. If you don't want to watch that video, it's fine. You can continue watching this. This is going to be a lot more detailed than that video. All right. So let's move on to the next step. I'm going to show you the time schedule. Okay, this is what the online exam schedule looks like. Okay, this is actually the schedule. So let me orientate you a little bit. So look at the bottom left of your screen. You can see here the source. This is also available from the online clinical examination candidate user guide. It's a PDF. It has a lot of detail about the clinical examination, the online exam. So the one that I have here is version 1.6 that was released on the 26th of March 2021. If there are any newer PDF on this, I will attach it with this video. Okay. So here, let me just give you a quick run through. All right. You don't have to memorize this. I just want you to get an idea. So when you have an idea, you're not lost, you're not confused, you're going to be alert every step of the way. So AMC recommends that you start turning on your computer at 8:50 in the morning. So this time is Melbourne time. Just remember Melbourne time. Okay, whatever the month you are at when you're doing your actual exam, it will either be AEDT or AEST depending on the month. It doesn't matter. Just make sure you're following Melbourne time. Okay, so when you're following Melbourne time, you won't go wrong. So 8:55, they recommend opening the Safe Exam browser. Safe Exam browser, if you look here, let me just magnify this for you. This is the icon of the Safe Exam browser. So what this icon is really just about a software that you have to download and install in your computer. So this is a software that when you click that software, what is going to happen is going to show you a very clean version of your desktop. There's not going to be anything on the desktop that you see or on your laptop. It's going to be very clean. Maybe one icon is there. The one icon could be the internet, the application, all right, the browser. So you're going to see that on there. And another thing you may see is a Zoom application. Okay. So once you turn on your Safe Exam browser, don't worry about this. Don't worry about the Safe Exam browser. AMC will give you all that information. You need to install this, otherwise you can't do your exam. AMC will tell you to do it a few days before, and if you don't do it, they will forfeit you from the exam. Meaning, if you don't do it by their deadline, you will not be able to, undergo the exam. So just be careful. Make sure you are up to date. Keep that in mind. The next thing that I want you to keep in mind is that after logging into the Safe Exam browser, you can click onto the Zoom link. Okay, don't worry at this point. I will show you everything on the slide and you can see that later on. I just want you to get an idea at this point. So once around 9:40, everybody will be in the common lobby. Okay, so this is almost an hour, for everything to be ready. So you just have to wait after your ID check. That means they will check your identity and then they will do the environment check and then they'll show you a candidate briefing video. This whole thing takes about 1 hour. Once this is done, approximately about 10 o'clock, that's when the examination starts. And the examination goes on for about 5 hours. Here it says that it starts at 10, it concludes at 5, but in my own experience, my exam concluded at 3:30 in the afternoon. So sometimes you're lucky if there's no technical problem. I heard of stories that some people have technical problem and the exam went on for an additional 1 hour or more than that, I'm not sure. But just keep in mind, like every technical problems can happen. So in an ideal online exam, it should end before 5 o'clock. Okay. And you will have a lunch break in the afternoon, Melbourne time. All right. So this is the schedule. Just keep that in mind. So let's move on to pictures. I'm going to show you some pictures on what happens on the exam. Okay, this is me a few years ago and a few extra kilograms of weight. And this is the day of my online exam. Okay, this is my house, the apartment at that time. So I'm sitting on the couch. I have a table here. Then my laptop is here. And it's a beautiful sunny day in Melbourne. So let me show you a bit more in detail. I'm going to bring out some sentences, some words. Okay, I'm going to label all of that. So let's start here on the top right hand corner. So there'll be an entrance ticket that you need to have. Okay, don't worry about that. I'm going to show you in the next the slide. Try to sit on a comfortable chair. The exam is going to be 5 hours. You don't want to sit on a stool. You're going to have a backache. Then you're going to have to do a mechanical backache examination on yourself after the exam. So just be careful of that. Don't sit on something that is uncomfortable. Sit on something which you can perform the exam well. Okay, so for me, what I did was a few days before my exam, I actually performed role play while I'm sitting on this same couch. So the exam day for me was just another practice day. That's how it felt to me, and I felt very comfortable on my exam day. So try to do something like that. Practice on the same place where you're going to actually do your exam. Let's start from the left here and then we work our way around, okay, from this direction. I'm going to share with you everything. So the first thing that you need to have is a wired headphone. Don't use wireless, because if your battery runs out after 5 hours, then you are going to have your personal technical problem. And that is going to cause you to have delay in your own exam. So that is very dangerous. Don't do that. You can directly speak with your laptop if you don't want to use a headphone. But this is personal preference. For me, because of my own personal practice, I know that headphones, I can hear a lot more clearer. I can hear every single word, and I don't have to ask the person like, pardon me, can you please repeat what you said? So I'm trying to save my time as much as I can. So I use a wired headphone. All right. If you guys want to be safe, a wired headphone is my recommendation. Next, you can have a couple of A4 paper, about 20 pieces of paper. Keep it on your side here next to you. Keep it handy so that you can, when your exam starts, you don't have to go and search for it. Then we're going to have some pen and some brush pen markers. This is like a thick marker pen. I will show it to you in detail. This is very handy in the online exam. The next thing is I'm keeping my mobile or my handphone just next to me. It's about a meter away. If you can see, I'm sitting here. This is my handphone here. All right. For those of you who can't see it, I'm just going to scan it. It's in the middle of my screen. Can you see here? In the middle of the screen, mobile phone. I've labeled it there. All right. That is where I kept my mobile phone. Just in case if you have any technical error, AMC may attempt to call you. So just keep the phone nearby. All right. Moving on to the right side of the screen. So keep your lunchbox nearby. So in the afternoon, all right, about 12 something, you will have your lunch break. So what I have here is some pizza. I think it's a macaroni pizza at that time. So you can have whatever you want, all right? So just make sure you have your lunch nearby. And I have some snacks and a box of tissue here. I have some blueberry muffin. This is my favorite. and they are, a lot of sugar and keep me hyperactive. Not hyperactive, but just keep me alert. You can have whatever snack you want. AMC is not going to tell you, please don't bring peanuts or don't bring popcorn or something. AMC gives you freedom in the snacks. Okay, just don't hide any notes inside your snack. That is not what you should do. Okay, the point is here, make sure you have your snack, because when you're having your rest session, the snack is very important to keep you awake. Keep a drinking water nearby. And here is a webcam. You can see I've just used a webcam during my exam day. But if you have a very good laptop or a desktop with a camera, so you don't have to worry about a webcam. You can also use the inbuilt camera, as long as it's a clear video. You must do role plays with the computer that you're going to do your actual online exam. That is how you will know. You cannot use a computer for the first time on your exam day. If something goes wrong, you will not know what to do. I recommend using a computer that you are absolutely familiar with. Okay, just keep that in mind. AMC recommends a laptop which is 14-inch in screen, and you need to plug the cable in. Can you see this thing? Look at my pointer. I'm just having my computer plugged into a power source so that it's always having full battery and I will not have technical issues on my side. All right, so I hope this is very clear. This is what you can do to prepare on the exam day. All right, guys, so remember I talked about the entrance ID ticket. So this is how it looks like. AMC will send this to you, so don't worry, don't have to print this out yourself. AMC will send you by postage. Okay, they will send the ID ticket. So how the ID ticket look like is this. This is my ID ticket. So on the left here, you'll have your beautiful face. You'll have your name here. And it says entrance ticket must be shown in the identification purpose. On here, you will see your exam date. This is the 21st of May. It's the 5th of May, the year 2021. It's also written here. The date is on Wednesday, for example. Venue is a Zoom exam and the time is given here. And then here, it gives you your candidate ID number. Whatever the number you have, it'll be printed here as well. So this ticket, you must have during your exam day. So if you have this, don't forget to use that. It's just, something that helps AMC with identification. However, my friends, if you don't have this, don't worry. You can also use your passport. Okay, the passport is still valid. Once you have your passport and you show it to them, AMC will register you as present, or you have arrived for your clinical examination. Okay, so this is an alternative. Just bear that in mind. All right, let's move on to the next thing. Here is the brush pen markers. Okay, this why I'm trying to show you this is, if you practice role plays with your computer, you will realize that using a fine ink pen, when you draw something on that and you're trying to show it on your camera to the role player on the other end, sometimes it forms a glare. They can't see your drawing. They will be trying to squint and look, what you're trying to show. So if you know what I mean, if you have practiced with a fine ink pen, this is what it looks like. You will have this problem. So the way to solve that problem is to use a marker pen like this. It's a small marker pen, small tip marker pen. This here on the right of the screen is exactly what I used for my own exam. Can you see? So the red marker pen here is exactly what I use in my own AMC Clinical Online exam. So I was able to draw very nice diagrams which are very sharp, very clear, so nobody needs to squint. It's all very clear. So I recommend you buying this, preparing this for your own exam. Okay, hope it's helpful. Okay, let's move on to the next slide. So on the day that you have booked your AMC Clinical Online exam, you will be seeing this in your AMC Clinical, your AMC Candidate Portal. What you will have is a countdown timer until your exam begins, okay, until the date of your exam day and your exam time. All right, if you see this is mine. I screenshot this so that I can share it with you guys. So if you look here, I'm looking at this 26 days before my exam, which is on this day. You will see a link which is in green color. And this link will become active only if the Safe Exam browser is used. Okay, so you need to, like what we have discussed earlier, you need to prepare all that. AMC will keep checking on you. So don't worry about that. At the same time, if they ask you to do something, please do it early. Don't wait until the last minute. Then you will have some problems. Okay, from this point, when this countdown timer have become 0, okay, if it count down to the day of the exam, how does it look like? So this is what it looks like. So this, my friend, on the screen is how it looks like when you are going to click the link at 9 a.m. Melbourne time during your online clinical examination. All right. Just remember here that you need to have your Safe Exam browser. From the Safe Exam browser, you go into your AMC candidate portal. This thing will be there. When you click this link, that's when the game begins. All right. That's when you go into the online exam environment. And I'm going to show you next. So here, my friends, this is how, when you click the link, this is where you end up. All right. Your Zoom app will turn on. You will have a Zoom app like this. So sometimes when you click the link, you might not be the first person there. So you got to wait. You'll be in the online lobby. You got to wait until somebody greets you. All right. So when someone greets you, it looks like this. There'll be a person here. This is not a real person, by the way. This is a name and someone I took from the internet. I'm just giving you an idea of how it actually looks like. So the person will be here, and then you will be on the right of the screen. Okay, you will see yourself here. But in the beginning, you will just have some name here. Maybe a name that following your Zoom, whatever name you have on your Zoom application. So this person here is your coordinator. So let's assume it's Jessie, and she's from the AMC. So Jessie is now going to check your ID. So Jessie is going to say, "Good morning, doctor. How are you? Hope everything is good. So may I know your name and your ID, please?" That is what this is about. Okay. So what you're going to do is you're going to take the ID ticket, which I showed you earlier, point it to your screen, tell Jessie, this is my ID. My name is so-and-so. For example, my name is Aaron's and my ID is, for example, 216255958. So when you do that, then Jessie here is going to adjust your name on the screen. See here, your Zoom screen here. Let me just amplify that for you so that you can see it in detail. So if I magnify here, your name, Jessie is going to adjust your name and your ID number here. Okay. So when you have this now, you will not be somebody else. Everything will be good. You are now set for your exam. So this is what I mean. Jessie will adjust your name and your candidate ID number here. Okay. The next thing, before Jessie lets you go, she is now going to ask you to show your surrounding environment. So what I did on that day was I just carried my laptop and just show a 360 degrees turn around the place where I was sitting. Okay, I just carry up my laptop and I just turn around. They are not so, they're not so fussy about it. They're not going to check everything. They're not going to ask you to bring your laptop into your toilet, for example. They're not going to do all those kind of things. But my advice is here, try not to cheat. Okay, be as honest as possible. This is an exam that tests your, your preparation, tests you as a doctor. It's a good assessment to go through. And trust me, guys, trust me, if you pass the AMC clinical examination, working in Australia is a lot more easier. Okay, take it from me. It's my own personal experience. I find that, after going through the AMC clinical exam, working in Australia, I have a lot more confidence. All right, confidence, definitely, if you pass your exam. So I want you to be honest and do your best. Okay, so that is what's going to happen here. Let me just refresh again. So I'm going to recap. So you'll meet a coordinator as soon as you click the link. All right. This coordinator will help you adjust your name and your candidate ID, and then do a quick environment check, maybe for less than, about 30 seconds. And then once that is done, this person, the coordinator, is going to push you into the common lobby. All right. This is how the common lobby looks like. Alright guys, let's continue from the common lobby. So once you're in the common lobby, this is how it's going to look like on your Zoom screen. Okay, so let's see how it looks like. You will be here on the top left corner. You will have all your other candidates slowly populating in the screen. Okay, you might begin with 3 people and then slowly the other person comes in, starts populating, and then everybody on the exam is in the common lobby. All right, that is how it will slowly begin. So this whole process takes about a couple of minutes. And once everybody has their names and their ID number adjusted for them and everything has been checked, then they will move on. Okay, so let me give you the tips here. What is happening at the common lobby? So the first thing, like again, we wait for all the candidates to enter. One by one will start entering. Okay, there'll be an invigilator here in the common lobby. So there'll be someone who's around who's going to, just hang in there and just make sure that everybody is doing okay. The next thing is once everybody is in here, AMC, the staff will start playing the candidate briefing video. You will see a video that is being played on your screen, and that is the candidate briefing video. So, just make sure you don't, miss that opportunity. See that before your exam so you know what they're showing you, and there's nothing going to surprise you. Okay, the best thing to do is not be surprised during your exam. When you're being surprised during your exam, you need some time to adjust to that, right? So I want to make sure that you know every single micro detail in your online exam. All right, so this is what happens. Okay, they're going to show you the briefing video, and keep in mind the exam starts right after the video. So when the video finishes, then you're going to tell yourself, like, let the show begin. Okay, you're going to get ready. You're going to get ready and do the exam. So to simplify for your understanding, okay, I'm going to make your screen into a blue box. Okay, so let me just go back here. So here's the common lobby, right? So your screen here, okay, I'm going to make it blue box. For everybody else, I'm going to make them a black box. Okay, I'm just trying to simplify this so that you can visualize the online environment, okay? Because this whole thing happens on the internet. I'm trying to make sure that you guys can understand how it looks like, right? So you in blue, everybody else in black box. Okay, so let's see how it looks like now. So this is the Zoom screen. I'm just simplifying it for your understanding. So you are in blue box, everybody else in black color box. Okay, now I want to take this another step further. I'm going to simplify it a little bit more. The Zoom screen, I'm going to take it out and I'm going to replace with an orange box. So this is how it looks like now. Okay, you are in blue, everything else is in black, everybody else is in black box, and the Zoom screen is orange box. So this is the common lobby layout in a simplified version. Okay, so let me just share with you what I mean. From this version, okay, I've simplified everybody and everything into this illustration here. All right, so now let's look at how the online environment looks like. So that is the next slide. So ladies and gentlemen, this is the online clinical exam environment, okay, in one look. So let me orientate you a little bit. So don't worry at this point if you're looking at this and looking at, oh, what kind of fancy gimmick this is. Don't worry about that. I'm gonna share with you, I'm gonna break down every single component so that you can understand this in absolute clarity. Okay, so let's orientate ourselves. The first blue box here is you. See here, you blue. Others are in the black box. The common lobby is in the orange box. Okay, this green box here is breakout station. AMC calls this the breakout station. Okay, so what happens here is that from the common lobby, AMC is going to divide you guys. Okay, so 5 candidates from here go into one breakout station, the next 5 into the second breakout station, the next 5 people goes into the third breakout station, and the last 5 will go into the 4th breakout station. Okay, I'm going to have a very detailed video on the breakout station. Okay, so at that time, I'm going to talk to you a lot more about the breakout station. Here, I just want to show you a glimpse of how the online environment looks like. So this green one is the breakout station. And from the breakout station, you'll be moved into an exam station. So here, the exam station, I'm putting it in the pink colored boxes. Okay. So this is how the online environment looks like. Right, now the next slide is I'm going to show you what are the stations, the number of stations in the online AMC clinical examination. So if you look at the bottom left of your screen, there are 20 clinical exam stations. All right. So I have numbered all of them. So if you count them 1, 2, 3, 4 and so on, you will have 20 of these 4 green stations and remaining 16 pink color stations, which are your exam stations. All right. So I hope you are following me so far. So if you look down here, these are going to be 16. So 16 exam station. 2 of the 16 exam stations are going to be pilot. Pilot means that for those of you who are not too sure, pilot stations are stations where AMC is really just testing the question. So these are questions that they have newly designed, and they're trying to see what is the performance and whether it's suitable to be tested on the candidates. All right, so this is how they are doing their research and development. So don't be bothered about that. And the other thing I'm going to tell you about that you need to know is that you will never know, or you will not be told that which station is a pilot station. Okay, so in other words, the point here that I really want you to understand is that you got to treat every exam station as if that you are going to be marked for that station. You got to do your ultimate performance, your best of the best performance every single time, 16 times for that day. Okay, so let's recap again. There is 16 exam stations, 2 pilot, and there will be 4 rest stations. Okay, the green ones here will become the rest stations once the assessment cycle begins. Okay, I will talk about that in absolute detail, all right, in the next couple of videos. So for now, I just want you to take the message that this is how the online environment looks like. You will have 20 exam stations, 16 total stations, 2 of it not scored, and 4 rest stations. And now guys, this is important. To pass the clinical examination, you need to pass 10 stations. That means if you look at these pink stations here, you need to pass 10 out of 14. Okay, 2 is not scored, but you must pass 10. So in another way of telling you is that you can afford to fail 4. If you fail 4, you still can pass. But if you fail 5, then you fail. Okay. In other words, you need to score 10. You need to pass 10 stations, and that's how you pass the AMC clinical examination. So I hope guys this is helpful. I hope this is absolutely clear. And in the next video, we're going to talk about the breakout station. So I will see you there. All right, guys, welcome back. So if you're joining me for the first time here, what you're seeing on the screen is a virtual or an illustration of the map of how the AMC Clinical Online exam looks like. So just to give you a quick rundown, this is really just a series of Zoom groups, okay, that AMC bring you from one group to the other and then to the next third level of the group. So if you're watching this for the first time, you might be wondering what these boxes are, you know, the one in orange, in green, in pink. So if you're having that trouble, please go and watch the couple of videos before this so that you understand how I simplified the actual Zoom screen into this. All right. So guys, what I'm going to talk about next is about the breakout station. So why this is important is it's because I want to give you some tips on when you look at a particular Zoom screen, you will recognize like, this is a breakout station. And then you will know what is coming next. So when you are prepared, you'll be alert. Okay. And then the chances of you performing in your exam is going to be a lot better. And that is my goal. My goal is to give you an orientation. Okay, guys. So like I said again, I'm going to quickly just orientate you here. So the orange box is the common lobby. So you here are in blue and everybody else in black. Okay. So the next level of the Zoom group is green. Okay, the green box here, which is called the breakout station. So AMC is going to move you from this top level group, the common lobby, into the next level group, which is the breakout station. And from here, they're going to move you again from this level group into the next level, the third level of the group. So you can see you're going from one level to the other, and then to the next level of group in the Zoom app. And this reminds me of a movie. Have you seen that movie called Inception? The one that was created by Christopher Nolan and starred by this guy Leonardo DiCaprio, something like that. The good thing about that movie is you go into a dream, and then from that dream you go into a different dream. So this is quite similar. From one group, you go to another group, and then from that group, you go to the third level of group. So the only thing here I want to give you an idea is that this is not a dream. This is your real exam. You're moving from one group to the other group. Okay, so just keep that in mind. This is just a sequence of groups, okay, that you're going to move from one group to the other. All right, guys. So at this point, I'm going to bring out this one green box out. Okay, this one green box is the breakout station. I'm going to just zoom that. So you can see here, you will have an invigilator in your breakout station. Okay, usually that person is on the top left-hand corner, and you are here, one of these people here. So I've made it blue. You are in blue box, and your other fellow candidates for that exam is going to be in the black box. So let's see how this looks like in the actual Zoom screen. Okay, so this is going to be how it looks like actually in Zoom. All right, so when you guys are looking at this on your exam day, where there is 6 of you in one Zoom group, then you know that this is called the breakout station. Okay, so here on the top left hand corner, I've just put someone there in that image. This is not a real person, by the way. So this is just somebody here that I've labeled as Jason. I just gave him a nickname, Jason. And so let's pretend, or let's assume that Jason, I'm going to zoom to him. Let's assume that Jason is the invigilator. All right, look at him. Oh, look, he's quite shocked. I wonder why. Oh, look, guys, there's a baby. There's a baby in the AMC Clinical Exam. So that's why he's shocked. I mean, there's no surprise in that if somebody else is a baby in there and they're doing their exam. Anyway, guys, so let's continue. So here, at this point, what I'm going to do is I'm going to give you some tips. I'm going to tell you guys what you need to expect when you are here in this breakout station. Okay, here are the points. Look on the left side of your screen. So the first thing I want to tell you guys is that my first tip is that if you're seeing this, it's going to be a couple of minutes before the exam station. Okay, so your next level from here is going to be the exam station. All right. What I want you to do is to be relaxed, okay, and to be ready for any possible case. That's my point or tip number 2. And my third tip of the day is do not assume that you're going to have a rest station next. Unlike the face-to-face exam, you can predict, you can see physically like your next station is an actual station, and following that, you come out, you have a rest station. In the face-to-face exam, you can do that. You can see that. But in the online exam, there's no way of telling what's your next station. You can't predict. The algorithm is run purely by AMC. You can get a physical examination station. You can get a counseling, diagnostic, history-taking station. It can be anything. It can also be a rest station. But my advice is don't assume. No matter what you do, don't assume your rest station is next. This is important, guys, because you need to be alert. If suddenly you have a physical examination station as your next station and you are thinking that is a rest station, it's going to be quite challenging to come out of that mood where you thought that you could take a break for a bit. Okay, so just be mindful. I want you to consider these tips when you are here looking at this screen and knowing that this is a breakout station. All right, so I'm going to go back to the illustration or the map that I've designed earlier. So here, just giving you an orientation again from the common lobby, you guys will be break out into a group of 6 people, or another way of saying this is that all of you guys as a candidate will be broken up into a group of 5. If you count the boxes here, the black box, there'll be 1, 2, 3, 4, 5, 1, 2, 3, 4, 5 in the second group. In the third group is another 5 people. So I'm not including the invigilator, okay? I'm just counting the candidates. So there are 5 in one breakout station. So from the common lobby, you come into a breakout station, you'll be divided into a group of 5 candidates per breakout station. And from here, you're going to be moved down. You see the green arrow here? You're going to be moved down into an exam station. All right, this is how the cycle is going to be. All right, so from here, the common lobby, you see the black arrows, you'll be divided very randomly. I don't know how they do it, but they have a way, an algorithm of how they do that. And then when you are in the breakout station, you will do one breakout station is linked to about 4 exam stations. So in order for you guys to see that, just look at this screen here on the left where my pointer is pointing. If you see this breakout station, it's usually linked to 4 exam station. So when you guys have completed this 4 station, AMC will then move you from this breakout station into the next breakout station from side to side. Okay, so you'll be moving up and down from the level of the breakout station to the exam station. And when you have done this these exam stations, you'll be then moved side to side from breakout station to breakout stations. So this is how the online environment works. Okay, and let's take one of these. Okay, I'm going to show you at this point how one exam cycle is. Okay, just to give you an idea so that you know what is going on. All right. So I'm going to take out this part. If you look at the red circle, this is what I'm going to zoom at, and I'm going to show you in detail how this sequence happened. Okay, so let's go into that. So here, guys, is an idea of how the AMC Clinical Exam, the online version, is conducted. You are now in the breakout station. You just came from the common lobby. This is what the gray arrow is signifying. You're now in the breakout station. From here, you're then going to be moved into your individual exam stations, which I've made it in pink. All right. So what I'm going to do next is I'm going to show you how that cycle happens. Okay, but before we begin, I just want to tell you at this point, here, if you count, there's 1, 2, 3, 4, 5 of you in one breakout station, and there's 1, 2, 3, 4 exam station group, which is linked to one breakout station. So there's going to be 4 of you that are going to come out from this breakout station. These 4 from here are going to be moved into the exam station. So by conventional mathematics, when 5 out of 5 people, 4 is out, 1 will be remaining in the breakout station. So that person who remains in that green breakout station, that station will now be a rest station. Okay, and I will talk in detail about the rest station in the next video. But now I just want to focus on how you guys, the 4 of you guys, are going to go in here. All right, so AMC is going to randomly push you guys into one of these exam stations. So this is what I mean. So if you can see it from just now, where 5 of you in this group, then when they push each one of you out, this station now becomes a rest station, and everybody gets into their individual exam station. So this one person went into here, the other person, maybe this is you went into this exam station, the third person into this exam station, the 4th person into this exam station. And the breakout station have now converted into a rest station. So this is how you moved from the breakout into the exam station. So during, and then the exam goes on. When the exam has concluded, that means after your assessment time, when you finish your 8 minutes of assessment time, now what is going to happen is that AMC is going to move you guys from these exam groups back into the breakout station. So from here, you're going to be moved back. Okay. So this is how it happens. So now you guys from here have went back inside, and then you will be seeing the same breakout station again, the group of 5 people, 5 AMC clinical candidates, and one wonderful invigilator in that breakout station. And that is a completion of one exam cycle or one assessment cycle. Okay, so what happens after that is AMC is going to reshuffle you guys. So whoever who went into this station will now go into the second station. And then from here, you'll move on to the next station and then the next. Okay, and once you're done these four exam stations, you will then move from one breakout station to the other breakout station. Okay, so that is how one cycle of the exam is. So just now remember, when you finish with one breakout station, you move to the other. Okay, and that's how you go through this about 20 times in your exam, and that concludes the AMC online clinical examination. All right, so I hope that is clear. The next video is going to be on the rest station. I'm going to give you a detailed explanation of what you guys need to do and can do and can't do in the rest station. So I will see you there. All right, guys, welcome back. So now we're going to continue with the rest station. Okay, so let's move on. So if you have familiarized with this virtual map that I've designed, that's great. So I'm going to go straight into how the rest station is formed. All right. So from here, the blue one is you. Can you see the indication over here on the left top corner? So your other candidates are going to be in black. The green one is the breakout station. Okay, so let's zoom that. Let's go into that. So from here, the breakout station, once everybody gets placed into their respective exam station, the one who remains behind, that person is now in a rest station. So let's see how that happens. So from here, just now, there were 5 candidates in one breakout station. When each one of them, the 4 of them have moved into the respective exam station, there'll be one person who is going to remain behind. Okay, the person who remained behind in the breakout station, that person is now going to be in the station that AMC is going to call as the rest station. Okay, I hope that is clear. I hope you get an idea how the rest station is formed. So it's just that whoever remains back in the breakout station, and that person, it's going to be able to rest for the next 10 minutes or so. Okay, guys, so at this point, I am going to zoom into the rest station and we're going to have a look at that in detail. All right, so this is how the simplified version of the rest station looks like. Okay, so let's say, for example, you get remained behind. Okay, so you are remaining behind and you are now in a rest station. So if you look here, here the blue box is you, and on the left, usually the left, there'll be an invigilator of the rest station. Okay, it's the same invigilator of the breakout station who's going to remain behind and just supervise you during the rest time. Okay, let's see how that looks like on the actual Zoom screen. Okay, so this is how it looks like, and we still have the same person. So this is just a made up person. Okay, I just took someone from the internet and I just called him Jason. So let's pretend that Jason is the invigilator for now, the rest station. Okay, and on the right here, it's going to be you in the rest station. So when you're on the rest station, I mean, let me zoom to you. I mean, look at this. This is just an image that I've took from the internet, but don't be too stressed in the rest station. I mean, look at him. He's quite stressed, but you can now relax because this is really just a rest station. So when you are here, I'm just going to give you a rundown of what happens. Okay, so the first thing that will happen is Jason here, he's going to ask you a few questions. He's going to ask you like, doctor, may I see your ID and your candidate number, please? Your name and your candidate ID number, please. All right. So you're just going to tell like, hi, Jason. Thank you for that. My name is Aaron's and my ID number is 216-25958, for example. Okay. This is just a made up number that I've put it over here. The tip that you can do is, instead of, looking into your entrance ID ticket, you can just read from your screen. It's fine. Just read up from here. Like, my name is Aaron's and I'm, I have this ID number here. Okay. So once the ID is correct and you are supposed to remain in the rest station, And then Jason moves on to telling you the rules of the rest station. Okay, we'll talk about the rules shortly, but just want you to know that he or she here, the invigilator, is going to tell you about the rules. And the next thing that happens after that is this person here is going to turn off their video and audio. So let's look at how that looks like on your Zoom screen. Okay, so this is how it's going to look like. All right, when the invigilator has already completed doing their job, they just turn off their screen and turn off their mic. Okay, you're going to be like this. So this is how it looks like. Can be a little bit awkward, but this is how the rest station in AMC Clinical Exam is. So guys, let's talk about the do's and the don'ts. I'm going to first start with the do's. Okay, look at the left side corner of the screen where my pointer is at. So let's take the first point. What you can do here is you can attend the bathroom. Okay, you can tell Jason you don't have to tell in the beginning. Just say like after 5 minutes and then now you decided to go to the washroom. You can, even though you don't see the invigilator here, you can just speak up in the camera like, excuse me, just call the name. Excuse me, Jason, can I go to the washroom now? And then the person will respond, okay? Because you are being supervised all the time. All right, so don't worry, just at any point, you don't have to decide in the beginning. You can decide maybe halfway through. Okay, I just want you to keep that in mind. The next thing that you can do is you can have your drinks, you can have some snacks, you can just do whatever you want to eat. But the thing here is that you can't turn off your screen. Okay, if you turn off your screen, then they might think that you're cheating. Okay, so don't do that. Just, you want to eat, you want to drink, just drink and, let them enjoy the show of you eating and drinking. Okay, here the green points are the tips that I want you to carry forward. I want you to try your best to do this. The first tip here, the green one, is try to relax. Try not to think about the previous exam station. Okay guys, you might be wondering why I'm trying to tell you this, but trust me, I have done the online exam myself, and I have friends who have done the AMC Clinical Exam. You might know people who do the clinical exam. So at the end of the day, guys, when you're in a rest station, there's always that, that time where your mind just kicks off and tell you things like, I could have done this, I should have done that, I should have do this for my exam, maybe I missed the critical error. Look, whatever the case is, it does not matter. All right, it really does not matter. You got to try your best to relax, because if you can do that for the next 10 minutes, your rest station is going to be around 10 minutes, 10 minutes plus. It is important because when you can take the full advantage of just relaxing, clearing your mind and preparing for what's coming up next, then the chances of you passing your exam is going to be a lot higher. Think about it. If you only make, there are 14 stations. If you have just went through a couple of stations, don't assume you did anything bad. How do you know? Sometimes you can't remember what you really did, or what you did not do. So don't worry about all of that. That is not for you to decide during the rest station. Your main purpose is to, get yourself back together and get ready, get prepared, and tell yourself this next point here, the point that I'm pointing right now. Tell yourself, I can do better next time. Okay, the next station. And I'm going to do better the next station. Okay, so that is what I do. I'll tell myself, Aaron, you can do it. You can do the next station better. You can do the next station better. Keep telling that in your rest station. Okay, so that is what I really want you to do. Don't beat yourself up, because if you do well in the couple more stations, the chances are you'll pass your exam. Okay, so this is very important. And now guys, let's move on to the right side of the screen. Let's talk about what you can't do during the rest station. So the first thing you can't do is you can't ask the invigilator your exam performance. You can't tell like, hey Jason, what do you think I did in the last station? First of all, that person don't know. Jason or whoever the invigilator here have not been in your previous exam station. They will not know that. So don't bother asking. You can't ask that. Okay. The other thing you can't do is you can't take notes. You can't try to, make your own recalls at that time. They are watching you all the time, during the 10 minutes of the rest station. This invigilator's job, the only job they have to do here at this point is just to look at you and make sure that you are not doing something against the exam standards. All right. So don't do that. And the other thing you can't do is use the mobile phone. Okay, just don't go and grab your mobile phone, call somebody like, hey ma, I didn't do the exam station, the last one very well. I'm quite sad right now. Can you talk to me? No, don't do that kind of thing. Don't touch your phone. Just remain there, enjoy your snacks and relax. All right. So I hope you get an idea here what the rest station is all about. So after the rest station, next, I'm going to talk to you about the exam station. So that is what the next video is going to be about. And I am going to see you there. All right, guys, welcome back. So now in this video, we're going to talk about the exam station in detail. All right, so this is going to be a little bit longer than the previous videos. So what I might do is I might just break it out, break this video into 1 or 2 more smaller parts so that you can come back and watch this again if you're going to watch this more than once. All right, guys, so let's go back to the screen. So here we have talked about the breakout station. We have talked about the rest station. And now I'm going to go into the pink color box here, which is the exam station. All right. So just before I begin, I want you to keep in mind that if you look at the bottom left corner, you have about 16 exam stations. All right, 16 exam station. 2 out of 16 is going to be pilot, meaning you will not know where they are located. They can be any of these stations. If you see any of your 16 stations, the pilot station is anywhere. So don't bother, figuring out whether that is a pilot station or not. All you got to do is do your best. Do your best for every single station. All right. So 2 pilot, what that means is that you have 14 stations which AMC will assess you. Okay. And to pass the AMC clinical exam, you need 10 stations, 10 out of 14. Then you have passed your AMC clinical exam. All right. So you are going to do that. I want you to pass your exam. So let me show you step by step what happens and how to take, use the time. Okay. Use all the advantage, as much advantage as you can learning from this video. I want to give you all that advantage in this session. So let's move on. So what I'm going to do now is, if you look in the slide, I'm going to take one of the exam station out and we are going to look into that in very, a lot of detail and try to bring out as much tip and, try to get you as much information so you can really maximally benefit from this. Okay, guys, are you ready? Okay, if you are, I'm ready as well. So let's move on. So guys, now let's just a little bit of a recap. So here is the breakout station. From the breakout station, you're going to move into the exam station. Okay, so let's see how that happens. From the breakout station, you have been now moved into your exam station. So let me just take you out. Okay, let's assume you have moved into this station here. You are in blue. Okay, if you look at the indicator here, you are in blue. All right, so if you have moved into this station, let's take that out. Let's zoom into that and see that more closely. So this is your exam station. Okay, let's assume you are in this station. So you are here on the top right corner. And now I'm going to show you what it actually looks like in the Zoom screen. All right, so this is how it actually looks like. All right, so when you enter the exam station, the first thing that you will see is you will have this sort of orientation. Okay, so what you can see here is there'll be a person here. This person in the middle of your screen, this is the invigilator. All right, sometimes the invigilator are medical students. Sometimes they're just AMC staff. So whoever this person is, what their job is, they're just going to share their screen, share the exam question, and just really control the flow of your movement in and out of that station. Okay, I'm going to talk to you in detail what happened. But for now, my point is, if you're looking at this, okay, if you're looking at this, you know that you are in an exam station now. All right, you're usually on the top right-hand corner here. Okay, guys, at this point, before I move on to show you what happens in the Zoom screen next, I want to talk in terms of time. All right, just bear with me. I know this is a little bit, it might be a little bit complex. Okay, you might get a bit confused, but if you are confused, don't worry. Just bear with me. I will explain to you and break it down into simple chunks so that you can understand what I'm trying to say. Okay, so let's talk in terms of time. All right, so this is a time scale on the screen here. So what I'm going to show you here is the events that happen. You know, what happens first, and then second, and then third, and then you come out of the exam station. So I'm going to talk in that terms. All right, so just bear with me. So let's start from here. Okay, in the beginning, when you just entered into an exam station, you are here. You see this arrow here? So you have a little bit of an extra time here. Okay, you can see this sort of light green or cyan color. So this cyan color here is an extra time. All right. The first point that I want to talk to you about is this extra time is only present in the AMC online clinical examination. You will not have this extra time in your face-to-face exam. So this is one little advantage. You know, you can still relax a little bit. You know, you're not really seeing the STEM and the task yet. So if you just entered the exam station, you can still sort of relax. You know, you don't have to if the face-to-face exam, like you just came out of the last exam station and you may not have time to recover. But here it's different. You have a little bit of an extra time. Okay, so this extra time is your entry into the exam station. So what happens during this extra time is that the invigilator will do an ID check on you. All right, so the invigilator will tell you like, doctor, may I see your ID and can you tell me your name? So you just have to tell like, hi, my name is Aaron's and this is my ID number. You just read out your ID number. All right. And the next thing the invigilator will do is they will also tell you if there is a prompt timer. A prompt timer is a time, like for example, if during your assessment time, if they're going to show you something, all right, like a physical examination or an investigation, they will show you to you after the prompt timer. For example, if in 3 minutes, they're going to show you a physical examination, they will tell you like, the invigilator at that time will tell you like, doctor, this station has a 3 minutes prompt timer. Okay, so you will hear this kind of things during the extra time. Okay, I just want you to try to follow me for now. Okay, just trust me. I know this can be a little bit confusing, but don't worry. I will have another video on prompt timer on how you can make use of the prompt timer to your advantage. But for now, just bear with me, guys. Just try to follow as much as you can. Okay, so just keep in mind that ID check happens here, prompt timer happens here. Okay, they will tell you about the prompt timer during this time. Okay, and the other thing is the extra time usually goes for about 1 to 1 minute 30 seconds. Okay, it can go around that time because what AMC is trying to do this point is making sure that all the candidates who are in the exam station and in the rest stations are supposed to be at those stations. So they will make sure that everybody is in the right place. So while that is going on in the background, you guys are just waiting there for, for that to be solved. And then once that have all confirmed and good to go, that's when you'll move on to the reading time. Okay. So I hope that is clear. I hope you guys get an idea what this extra time is all about. And the other thing is that I want you to know is, if you're wondering how is this different from the face-to-face exam, the difference is the ID check happens in the extra time for the online exam. But for the face-to-face exam, the ID check happens during the assessment time, in the first few seconds of the assessment time. So this is another difference between the online exam and the face-to-face exam. Okay, so I'm going to repeat what I just mentioned. What I'm saying to you is now that in the ID check for the online exam, it happens in the extra time. Okay, so you can easily, comfortably tell your ID and your name. Whereas in the face-to-face exam, that happens in the first part of your assessment time. So this is the difference, okay, between the online exam and the face-to-face exam during the exam station. Right? Hope you guys got that message. So now let's talk about the next event. Okay, from here, you're going to move into the reading time. Okay, so let's see how that begins. So the reading time really begins when you see on top of your Zoom screen a message from someone called a rate coordinator. Okay, AMC gives this sort of a designation to a person to coordinate the exam, and they go by this quote, rate coordinator. All right, maybe in the future they might change it to something else, but as long as you see on top of your Zoom screen a message saying that to begin reading time, so then you are going to move on to the reading time. Okay, so when you see this message, get ready. You're going to see the stamp and you're going to see the task for the first time in that station. So what happens after this message is that the invigilator will start sharing the stamp and the task on that screen. Okay, you will start seeing the stamp and the task, and then the invigilator will then turn off their video and turn off their audio. So you will be alone here. Okay, you will be just by yourself looking at the task, looking at the stamp and trying to make sense of it. Okay, that's how the reading time happens. So let me at this point out the obvious here. The obvious thing is that you will have a full 2 minutes, pure 2 minutes reading time for your online AMC clinical exam. Okay, this is another difference with the AMC face-to-face exam. In the face-to-face exam, you don't get a full 2 minutes, because let's assume this is the face-to-face assessment time. When you exit, if you look at my pointer here, if you exit the face-to-face clinical exam, if you exit this point, if you exit here, this exit time, there's a bell. When that bell rings, that is the beginning of your next station reading time. So in the face-to-face exam, as you exit, you're exiting and then you're going to your next station, and then you're straight away going to read. All that is within the 2 minutes. But this online exam, you have a full 2 minutes. You're already seated down. All you're waiting for is the stamp and the task to appear in front of you. So you have a full 2 minutes, unlike the face-to-face exam. So that's another sweet thing about this online exam. All right. So let's move on to the next step. Let's see what happens after the reading time. So how do you know when you're moving into the assessment time is another message from the rate coordinator. When you see on top of your Zoom screen, don't worry about how it looks like. I will show it to you in the next couple of slides, but just bear with me. I want to just share with you so that you can understand how you're moving from one event to the other. All right. So when you see the message to begin the examination, then you know that you're moving from the reading time to the assessment time. All right. So what happens at this point is that the stamp will continue to remain on the screen as it was remaining during the reading time. Okay. And then what happens after that is that the role player or the SPA, the standardized patient actor or actress, they will turn on their video and their audio and start interacting with you. Okay. So that's what happens during the beginning of the assessment time. And during the assessment time, okay, as you proceed from minute 0 to minute 1, 2, 3 until the whole 8 minutes, during that 8 minutes, what happens is, remember the prompt timer that we have talked about? If there are any prompt timers, for example, if there are 3 minutes prompt timer, then that invigilator at that 3 minutes of your assessment time will start talking. You will say like, this is your 3 minutes prompt timer. Then that person will start sharing whatever they want to show you, the extra thing, either a physical examination, sometimes an image, sometimes investigation, whatever they want to show, they will show it when they mention the prompt timer. Okay, so prompt timers can be at 3 minutes, 5 minutes, can be any time really, whatever the time AMC decides to put there. Okay, so these are the things that happens during the assessment time. So guys, if you've followed so far, excellent. Now I'm going to show you this event again from the Zoom screen point of view. So let's go back to the Zoom screen. So look at this arrow here on the top here. So when you're in the exam station at this point, this green here is the extra time, remember? So when you're here, this is what you're seeing, right? This is how you enter the exam station. So you see your invigilator here. So this person here is just a made up person. I'm going to go ahead and call him Joe. So Joe, at this point, he's going to welcome you. He's going to say, hi, doctor, welcome to this exam station. So my name is Joe. Doctor, can you please tell me your name and your ID, please? So that's what Jason or this invigilator is going to do. Okay, he's going to ask you for your ID. Again, all I want you to do is just read from your screen. Okay, let me just zoom there so that you can see what I'm trying to say. So I'm going to zoom here. So you can see that you will have your name and your ID on this small screen here. So just read up from that. Like, hi Joe. So my name is, just tell your name and tell your ID number. Just read it out from here. Okay, so that's all. Okay, it's not hard and fast. It's just simple. So just do that. And then Joe will say, thank you, doctor. And then he will say, doctor, this station has a 3 minutes prom timer, for example. Okay, so this is what happens during the extra time. Okay, so I hope this is clear. I hope this is crystal clear to you guys. So this is the beginning. And once that is over, sometimes the extra time can be a bit long. You be just looking at Joe. Joe is looking at you. You just have to wait there. It's a little bit awkward, but that is how it is in the AMC Clinical Exam Station, the online version. All right. So just wait there. And remember, the reading time starts when you see the message. And let me show you how it looks like. All right. So this is how it looks like. All right. I'm going to just zoom my screen here. So you will have a message like this, all right, from rate coordinator to everyone, begin reading. When you see this, you know you are here, all right? So I'm just going to zoom out. So what I'm trying to say is, when you see this message here, you know you are at the beginning of your reading time, all right? So when this happens, what is going to happen next? Let's look at it. So Joe, this guy, he's going to start sharing the stem and the task, okay? He has that stem and the task. So he's going to share his screen and he's going to pop out over here. From here, he's going to move over here. And then you are now going to see the stem and the task on your screen for the first time for that exam station. You're going to go down here. And Joe is going to remain up here. Okay, so this is how the reading time begins. All right. So the other thing I want to quickly point out to you guys here, let me just go back one step. What I want you to understand is, during your exam station, you will have a couple of other people in your Zoom screen as well. Okay, if you look over here, the screen bottom to you is going to be someone who's going to be named SPA or RP, which is role player. SPA stands for standardized patient actor or actress. And below that is an examiner. Okay, this examiner here, you will not see the examiner throughout your exam station. They will not show themselves, nor you will hear their voice. So, you might as well just assume that they are not there. I think that's the best thing to do. Just pretend that the examiner is not even in your exam. I mean, they make it look like that, right? So you take that as an advantage. Don't have to be bothered about your examiner. And below that, sometimes you can see some of the stations may have a QA examiner, just some quality assessment sort of examiner. So don't be worried. So these are the extra people that you will see in your Zoom screen. All right. So I just want to point that out to you. So back to the reading time. So let's continue from where we stopped. Okay. So when you start seeing this, Jason now, this guy here, he's going to turn off his video and turn off his audio. So this is what I mean. All right, guys. So this screen here is how a reading time looks like in the online clinical exam. Okay, so when you're looking at something like this, you are definitely in the reading time. Okay, so let me go ahead and give you some very important tips that I want you to, practice during this time. Okay, so let's bring out that tip. So just look at the left side of the screen now. So let's go together with the tip. The first thing I want you to do is, I want you to only focus 100% on the task and then the stem. Okay, 100% task and then stem. Only here. Please don't go and wonder what Joe is doing, or don't go wonder who the hell is behind this screen here, or what the examiner is doing. Am I looking proper or not? Don't be bothered with all of that. Your job here is to really make sense of what's given to you. All right. And the next tip, I want you to begin with the task. always start with the task. Never start with the STEM. Don't ever do that. All right. In your exam, you got to always do the task first, so you have an idea what you need to do during this station. My third point to you is that I want you to simplify the task. Okay. So let me give you an example of what I mean by that. So guys, the screen is blurred at the moment because I want you to just focus on what I'm what I'm talking to you. But now I'm going to unblur the bottom here. Okay, so you're going to be able to read the task here. Okay, so I'm going to show you how to simplify the task. Okay, so now I've unblurred this. You can start reading the task here. So the first task is take further relevant history from the parent that you would require. The physical examination finding will appear on the screen after 3 minutes. So let's go through one example of a task. So what you can see here is the first task is history. When I say simplify the task, AMC likes to ask very long, they like to give very long sentences for the task, but all you got to do is just simplify it. So take further relevant history. All they're asking is history. So just remember history. Okay. And physical examination appears on the screen after 3 minutes. So this is a 3 minutes prompt timer. The next task is counsel the parents on the most likely diagnosis. So here, diagnosis. All right. So history, diagnosis. And the third one, advise your further management. So history, diagnosis, and the third point here is going to be management. So history, diagnosis, management. That is all I'm trying to tell you. When you simplify the task, all I'm trying to tell you to do is, instead of remembering this entire long sentence, just take one word out of each one of them. So first one is history, second one is diagnosis, third one is management. So you remember that way. History, diagnosis, management. History, diagnosis, management. Now, when you're going to read the STEM, it's going to make a lot more sense to you. Okay, you're going to get as much information out from here as possible. And then you're going to know what you're going to need to ask, because you already know what is given to you and what is not given to you. So that is going to be the additional thing that you need to do in your first task. That's why simplifying your task is very important. Okay. And my fourth point over here is for you to start reading the STEM. Okay, just read the STEM quickly. So when you do it this way, I hope that you only do it one time. You don't go and read it a couple of times. Okay, when you do it correctly, you will just read the STEM usually once. All right, so that's why if you can, guys, try to do as much role play practice as possible. Try to quickly read it, get the main point. I will do a very detailed video on how to read the STEM and task. Okay, so I will give you a guide on that video. All right, so I hope that this is clear to you. So now I'm going to move on to the beginning of the assessment time. All right, guys, let's continue to the assessment time. So after the reading time, you will then move into the assessment time. Okay, so how you know that you're going to move into the assessment time is through the message on the top of your Zoom screen. Again, let me just zoom that. So if you look in the middle of your screen, you can see that the red coordinator has signaled a message again saying begin the examination. So when you see something like this, you know that you are here where this arrow is pointing. You're in the beginning of your assessment time. Okay, so let's look at the events that happen during the beginning of your assessment time. So what will happen first is that you will see that this person down here, the role player, now that person is going to turn on their video and their audio and start interacting with you. So let me show you what that means. So then this is what it is. Okay, as soon as that message has turned on, this person is going to turn on their screen and turn on their audio, and you're going to see that. Okay, so look, this guy here is a pretty serious role player. So hopefully you get a role player which is nice and kinder to you. But anyway, I want you to be ready and just to keep that in mind. So this is the beginning of your assessment time. All right, at this point, guys, I want to give you some good tips that you can utilize as you are performing your exam. My only aim is for this tip to guide you to make sure that you are doing your best during your exam. So let me bring the tips out for you. So here, the tips is on the left of the screen. So let's go through one by one. All right, so the first thing I want you to do, I really want you to just focus 100% on this person. Okay, focus 100% on the SPA or RP. That means the SPA I've showed what is the abbreviation for that. So SPA stands for Standardized Patient Actor or Actress, and RP is role player. Sometimes they have that terms. I just want you to be aware of who is having what term. Okay, so your role player is going to be on this screen, and I want you to only focus on that person. Okay, because if you want to pass your exam, only this person's interaction with you is going to enable you to pass your exam. Okay, don't be bothered about the examiner. Don't be bothered about your invigilator. Just pretend that only you two are around in this assessment time. Okay, so when the role player starts, they will always start with an opening statement. Okay, this is point number 2. I want you to take this message. When the role player opens or shows their screen, they will immediately start with an opening statement. The opening statement may sound something like this. Okay, for example, if this is a pediatric station, they will say like, "Hi doctor, my child is not well. Can you do something?" It's a statement. It's always something that they will try to say before you talk. Okay, so let me try to say that again. I hope you guys can get this message. In the exam station, when the assessment time begins, the role player will always say something first, and that is called an opening statement. This person is going to tell you some kind of statement, and what you need to do is you just have to wait for a while. Just don't speak immediately. Just give about 5 seconds. Let this person talk. They're going to say something. The issue is, if you talk as soon as this exam station starts and this person talk, you're both going to clash. He's going to say something, you're going to say something. It's going to sound very awkward. And not only it's going to sound awkward, you are wasting your time. You can imagine, right? I mean, he's going to say something, you're going to say something, and you're going to say like, "Oh, sorry." And then he's going to say sorry. And then you guys are going to wait to see who talks next. And you might lose about 10 seconds. Don't do that. Just be patient. Let that person talk. Let the person say the opening statement. Now, this is my next point. Whatever the role players say, after they have said that, the next thing you got to do is begin introducing yourself. So this is the point that I'm putting here on the screen. So for example, let me give you an example at this point. So if the role player is saying a statement, just wait for that to finish. After their statement is finished, you start your introduction sentence. Like for example, "Hi, my name is Aaron's. I'm one of the doctors here." And then the next thing you do is you ask their name. "Can I know your name, please?" And if this is a pediatric station, you also got to ask their child's name. For example, "Hi, my name is Aaron's. I'm one of the doctors here. May I know your name and your child's name, please?" Okay, and then you write their names down. Okay, so this is what I mean by this point. Okay, so begin introducing yourself and then ask for their name. Okay, so this is what you got to do at the beginning of your AMC online clinical exam. All right, so guys, moving on, I just want to share another tip that if you look at the bottom 2 points here, just bear in mind the AMC clinical exam is really a communication exam. All right, I've made a video on how to prepare for the clinical exam. Please go ahead and look at that video to get an idea of how you need to perform during the exam station. But my point here is that try not to be too medical. Okay, try to speak in simple English. And that's why I put this point. It's usually 90% communication skills and 10% is really your medical jargons and all the medical knowledge that you're going to share with this person. And that is how AMC is, marking in the exam. All right. So as long as you do this, the chances of you passing your exam is a lot higher. Okay. So I hope this is clear. The next thing I want to just give you an idea is the prompt timer. So just a short tip here. So during your assessment time, you will have prompt timers. So what happens is, let me just go back one screen. If you have a prompt timer here, you see the middle here, your screen, you can see the STEM and the task. During that prompt timer, what happens is this person here, your invigilator, he is going to share additional information. Okay, let's assume there's a 3 minutes prompt timer and let's see what happens at the 3 minutes prompt timer. So at the 3 minutes, it's this blue arrow here. Okay, during this blue arrow, this person here, the invigilator, will start telling you, "Doctor, This is your 3 minutes prompt timer, and immediately he will change the screen. From here, this is your STEM and your task, and now you can start seeing your physical examination. For example, sometimes you will see an image. They might also give you an investigation. So whatever is it, the screen will change during the prompt timer from here to here. Okay, so just be aware of that. This is what happens. And sometimes some of the station, in my experience, what they do is, sometimes I think this is like some kind of note, like a document. So sometimes they just scroll the document and then you don't see the STEM and the task anymore. All you see is just like the physical examination, for example. So if you want to know what your task is, you can always tell the invigilator to go back to the task. For example, I will just say like, hi Joe, can you please show me the task again? Like that, during your assessment time, so that you can see what's your next task. Okay, so I just want you to keep that in mind. You can always talk to Joe. He's listening to you even though you don't see him or he muted his mic. Okay, so this is a prompt timer. Okay, so a prompt timer can be 3 minutes, it can be 5 minutes. They can give you at any time the prompt timer. Okay, so just bear in mind that these are the events that will happen. Okay, so let's see how the exam station ends. Okay, it ends when the message from the red coordinator on the top of the screen again. So you will see this message. Let me just zoom there. So when you see this message, from the red coordinator to everyone, this station is now complete. Candidates will return to the breakout/rest station to await the next rotation. So when you see this message, then you know that you are here. Okay, you are at the end of the assessment time. So guys, here what I want you to bear in mind, this is a little bit of a disadvantage of the online exam. The moment you see this message from the red coordinator, you are going to go out of this exam station in the next 1 or 2 seconds. So why I'm saying this as a disadvantage, you might have heard of a story from people who have done the face-to-face exam, when you read some recalls and you see that some people mention in their recalls, like when the bell ring at the end of their assessment time, as they are walking out, they will tell 1 or 2 more points, which might even give them that additional mark. But in the online exam, you can't do that. This is out of your control. As soon as you see this message on the top here, the next thing that it will happen in the 2 seconds is, boom, you will see this screen. Okay, you'll go back to your breakout station. It's so fast, it happens so fast. So sometimes what I do is, when the moment I see this, I'll immediately just say thank you. Right, thank you, whoever the patient name is, like, thank you, John. That's it. Because it happens very quickly. So there's no point, trying to do anything else, right? So whatever you got to do it very quickly in your online exam. So don't waste your time. Don't save anything for the last minute. Practice as much role play as possible and keep it within 8 minutes. All right, so as I mentioned just now, as the end here, the next thing you will see is this. Okay, you'll go back to your breakout station. All right, guys, so I just want to go back to the simplified version. So this is the simplified version of your breakout station. So next, I want to show you the map. So from here, when you're from this exam station, you have now gone back into the breakout station. So what is going to happen next is AMC is going to rotate you to the next station. And this goes on and on for about 20 times. And that's how the exam is conducted. Okay. So guys, I hope this gives you a very in-depth look into how the exam station of the online exam is. And I hope you learn, all the tips and tricks during each of the events, because if you know that, the benefit is that you're going to use that to your advantage. Okay. You can know what is going to happen. You will not hesitate. You will do it very quickly. All right. So at this point, guys, I want to wish you all the best for your AMC online clinical examination if you're doing the online exam. And I will see you in the next video.